they're grab something. First of all, I'd just like to introduce myself. My name is Bianca Bell. I'm the Director of Primary Healthcare Improvement here at the Northwest of Melbourne PHN. Thank you very much for joining us at our second PIP QI session. This session is also being live webinars, and it will also be a taped webinar that will be available on our website sort of from next week that you can tell your colleagues about, or if there's anything you want to go back over, you're going to be able to watch that. So welcome to all of the people watching via webinar. Just in terms, because it is a webinar, what we're going to do is the people via webinar, and that's why Madeline is sitting there manning the kind of spaceship setup we've got going on there. We're going to have questions at the end, particularly for those in webinar, so they're actually able to type in their questions and we will be answering those at the end of the session. If anyone in the room is asking questions, please feel free. We'll just be repeating those just to make sure that the people on the webinar can hear the question that's being asked and therefore the answer. So before I go any further, I do just want to acknowledge the traditional owners of the land, the Wurundjeri people of the Kulin Nation, whose land we meet on today, and pay respects to elders past, present and emerging. I also just want to introduce the people in the room who's here today from the team. So we've got Michaela, who's the Manager of Primary Healthcare Improvement, who'll be talking in a moment, and Jess, who is the Manager of Primary Care Improvement. She will also be speaking. We've got Sonia, for those who know, Marie, Yvonne, Joe, Ange, Madeline on the spaceship setup. Anyone else I haven't seen there? No, beautiful. It's just checking there's no one else hiding. So a little bit of a, oh, we're not working. We're not working. Okay. Just don't seem to be able to click through these slides. Suggestions?
It should be, it was working before we started.
Gee, we're working, sorry, I'm just having trouble being able to click through the slideshow. I'm not quite sure what's going on there. Okay, that's all right, we'll just do it manually. So just a little run through of the agenda today. So obviously the welcome, which we've just done. We'll be giving you an overview of PIP QI. You've probably seen a lot of things that are out and about and information we've been sending out through our newsletters, but really kind of breaking it down into what it is and what are the requirements. We're going to talk a little bit about quality improvement in general practice and how we can help you. So what is it that the PHN can assist you in? We'll then have an open question and answer session, and then an opportunity for those that are in the room to meet with your new relationship manager if you haven't already met with them. So I'll hand over to Michaela.
Do you mind staying there just to do that?
Oh, sure. Yeah, okay.
Hi everyone, my name's Michaela, and I'm just going to go over PIP QI really and what it is and what you need to do. So first of all, PIP QI is the Practice Incentive Program Quality Improvement Incentive. It's a new quality improvement incentive that came in on the 1st of August. So it's brand new and it replaces some of the existing PIPs that kind of been rolled up into this new incentive. How much will the payment be? So this PIP is actually the second highest per copy PIP that's out there. So it's worth up to $50,000 a year for practices, which works out at $5 per standard weighted patient equivalent.
Is that in addition to the e-health?
Yes, so this is a whole different PIP. So the PIPs that are going, the cervical screening PIP, the diabetes PIP, the quality prescribing PIP, and the asthma PIP. So they're all going, but all the rest of the PIPs are staying. So this is in addition to all the rest of the PIPs that are already there. Yeah. So really I wanted to go over who does what, just to make it clear. So the Commonwealth, they designed the whole new PIP QI program. So they designed the requirements and what practices need to do and what they need to submit for the program. The PHN's role with this is really to support practices with PIP QI. So we're here to help you understand what it is, help make sure that you get registered for it, help you with submitting the de-identified data, so the PIP eligible data set, and with doing quality improvement activities. And then the Department of Human Services, the same for all the rest of the PIPs, they do all of your PIP payments. So what do you need to do? Lots of people are asking, what do I actually need to do to get this PIP payment? So really, first of all, you've got to be eligible for PIPs. So that means you've got to be registered for accreditation or accredited. You also need to make sure that you register for this PIP. So you might already be registered for other PIPs, but you actually have to go into your ATPOS account and specifically register for this PIP. And we've got some instructions over here on the table about how to do that, how to use your Proda account to do that, and if you don't have one of those, how to set one of those up. You then actually need to tell us what your PIP ID is, because that's how we report to the department. So once you've gone in and registered for the QI PIP, you then need to let us know, send us an email just with what your PIP ID is so that we can record that. The next thing you need to do is electronically submit the PIP eligible data set to us once a quarter. So we use the PEN tool as a way to extract your de-identified practice data. And if you've got PEN working in your practices at the moment, that happens every month and you don't have to do anything. We have a scheduler that automatically extracts that de-identified data once a month. For the requirements of the PIP, it's once a quarter. So we collecting that data once a month means that we've got 3 chances in that quarter for you to submit your data. So if for whatever reason it doesn't work once or it doesn't work twice, we can make sure there's 3 chances so that you definitely get your data to us to meet that criteria. And then the last thing that you need to do is participate in quality improvement activities in partnership with us. So that's really what we're here to talk to you about as well today, is the different ways that you can do quality improvement. And quality improvement doesn't need to be something huge. It can be, you know, whatever's appropriate for your practice. But our team are here, and we've got some resources and tools here as well to start getting you on the road to participating in quality improvement. So the PIP eligible data set really is these 10 measures and some demographic criteria that you can calculate these measures. So you probably see these kind of floating around. You don't have to do your quality improvement activities around these 10 measures. You don't have to actually do anything around these measures in your practice. But these are the measures that the department is looking at for the PIP eligible data set. So you submit that to us at the PHN. We don't send that any further. So we don't send this information on to the department. We just have it de-identified and we say, yes, you've submitted the data. But these are all things that practices really, they're all really chronic disease focused. So they're all things that if you were interested in looking at, you might want to design some quality improvement activities around. And this is really just the timing. So as I said, from the 1st of August, you go on to ATPOS and you can apply for the QI, the PIP QI, sorry. And then you've got a quarter to submit your data. So the first quarter is from the 1st of August until the 15th of October. So you've got 3 chances within that time to submit your data to us at the PHN. And then the next quarter starts from the 1st of November. And you've got, again, 3 chances within that quarter for you to submit data to us. And as I said, you submit that to us, we don't send it any further. But what we do say to the department is, yes, tick, we've got your data for that quarter. And I'll now hand over to Jess, who'll talk to you about quality improvement activities and how we can do those.
Good afternoon. My task today is to cover off the continuous quality improvement part of the PIP QI eligibility requirements. So I'll just give you, and I've got maybe 4 slides to do that. So I will just start by giving you an overview about what continuous quality improvement means, what you can start doing in your practice, and how we can help you with that. So continuous quality improvement, or quality improvement really, is an activity in your practice used to monitor, evaluate or improve the quality of healthcare delivered by the practice. So improvements can be made in response to a range of things. So it could be around your PenCat data, it could be around feedback from patients, it could be around feedback from members of your practice team, and also anything that's come up in your issues or risk registers that you have in your practice. The main thing that we say when we talk about focusing or working on continuous quality improvement in your practice is that it needs to be meaningful and a priority for you in your individual general practice. So some of the things that you might want to start thinking about in your practice in terms of what can be done in terms of continuous quality improvement. And when we say continuous, the definition of that means that it can't just be a point in time activity, so not just a one-off thing, but something that is ongoing and has a plan for how it rolls on over the time in your practice. So one of the things that we would say is to start thinking about what you're currently doing in your general practice. Review that, review what some of the problems are, what some of the opportunities are, some of the, some of your wish list items about what you want to do differently or want to change in your practice. Really decide on that as a practice team. Quality improvement happens not by one person driving something, but by the whole team getting involved and making a plan on how they're going to work in terms of quality improvement. One of the really important things about quality improvement is how you measure what has changed in your practice when you planned an approach or an activity. So what data can you look at to make sure that you're driving and measuring your change in practice? So things like we've talked about, PIP clinical audit tool, maybe some of your patient surveys that you've done, or other sort of areas might be some of the things like, can someone give me another example?
Diabetes?
Yeah, so looking at your current patients on your diabetes register and then doing a bit of a cleanup of your register and then looking at how many patients are on it from that point to the next point. So that's an example of where you can be looking at an area and then targeting and changing it over the time. So in terms of the PIP QI, what is some of the evidence or some of the ways that you can demonstrate that you're participating in continuous quality improvement? One of the things we're advising practices to do is start thinking about how you collate and document some of your activities in continuous quality improvement. So a really basic thing might be setting up a shared folder on your computer systems that's around quality improvement. So all of your activities or your documentations as they relate to continuous quality improvement get saved in one spot. You might even want to have that as a folder if that's something practical for you. Ensuring that you're documenting any of your discussions or your PDSAs around quality improvement. So if you have a standard agenda item for your team meetings or your clinical meetings, that you're including that as a line item. Some of our practices are even setting up individual practice meetings around continuous quality improvement. So having a QI committee, which has got representatives from the different parts of your practice team attending. One of the really practical things that we suggest and know works well in practice is setting up a practice board in your team room, which has some of your quality improvement activities, who's involved in what, some of the outcomes of those, and even photos and celebrations around those activities. And also the next part which we'll talk about is ensuring that you're working with the PHN on developing a practice improvement plan, which can also form some of the evidence for your participation in continuous quality improvement. So how can we at the PHN help you? And you would have met maybe before and after some of the lovely program officers who will be supporting you on your journey. So every general practice has an allocated relationship manager, and you'll see on your little name tags that you'll have a name underneath your name on the right-hand side there. So please go and connect with them. They'll be your point of contact in terms of supporting you around your quality improvement journey. When you connect with your relationship managers, they'll step you through what we're calling a practice improvement plan. And that's a document that we use to facilitate conversations around the quality improvement activities you would like to undertake in your practice. And it's also a way that we can coordinate the support we provide with you and your practice team. We also have a range of tools and resources, including our quality improvement guide and tools resource, which is about getting you started and helping you to link into some of the key and templates that you might want to link in with. What else can we support you with? So that's the QI guide and tools, but also obviously one of our key enablers for undertaking quality improvement in general practice is the PEN clinical audit tool. Bianca will go into more detail about the benefits of the PEN clinical audit tool and what it can achieve with working with you in your practice team. But we also have a range of other programs and resources that are available to you in your practice teams. So, for example, Health Pathways. Also, we have a range of face-to-face and webinar education opportunities that will be coming up. And also we're developing some continuous quality improvement packages for people, and they will be around priority areas or topic areas that may be useful for your clinical teams or your practice teams. We'll also be providing updates around changes to PIP QI specifically, but other health reform initiatives or government initiatives that are relevant to general practice. So please keep connecting with us, your relationship managers, and also one thing that I'll just mention is our GP newsletter, which is a new newsletter that's specifically around working with general practice. So there'll be a lot of key messages that we will convey through that. So if you haven't subscribed or you'd like to subscribe, please contact us about that at the end of the session too. Thank you. I'll hand over to Bianca.
Thanks, Jess. So just really quickly, as Jess was talking about, so here at the PHM we do offer Pancake for practices, and I guess Pancake is a way that you can share data with the PHM, and it also has some other functionality that I think will be really useful in terms of being compliant with PIP QI, and I guess how to kind of easily visualise data at the practice for really being able to identify the priorities for improvement. So it allows a number of things. So you can really get in and examine your data really easily in a sort of easy to understand visualised way. You can then at the practice level go in and have a look at who are those patients that actually that PENCAT data, the PACCAT data is referring to. You can also monitor the health outcomes of your patients. So there's ways you can actually see how well you're doing in certain areas in a really easy to follow graph that everyone at the practice can see. And we think will be really key in supporting practices to undertake quality improvement activities. Part of the suite that's offered by the PHN is obviously the scheduler that is sort of set up as a bit of a set and forget. So with your consent and signed data sharing agreements, it's a way to share the de-identified data with us at the PHN. In a way that happens automatically. And as one of the girls alluded to, the requirement is to submit data to the PHN once per quarter. We've currently set up the data submission via PEN for practices who have that to come in monthly, which will give us an opportunity to look at which practices is actually we're receiving. So you've got 3 opportunities. If for some reason that data submission fails, we'll actually be able to see that and be able to contact you to say, hey, that data hasn't come in, we have to make sure it gets in the next time. So it's giving a little bit of security that if it does fail.
How long does the data extraction take? Like, does it happen after hours?
Yes, it does. 2 a.m. I think it's set to run at.
On average, how much?
Depends on the size of the data, but size of the practice, I beg your pardon, and therefore how much data. But
what about one of the bigger practices that you know of?
A couple of hours to run. Yeah.
And it really varies depending on the capability of the system and a whole range of factors. But we do have a Kalia who's the coordinator of all of our PEN activities and the scheduler and the data submission. So her role is really to connect with practices if there's an issue that will be really proactive around following that up with you.
And the data sharing window, which we put up earlier, which is from the 1st of the quarter to the 15th of the last month of the quarter, so for this quarter, the 15th of October, our data submission used to be set up to run on the 27th, so we've actually changed that this month to run on the 1st, which make sure we do have those 3 opportunities throughout the quarter to be able to meet that requirement. So as I said, Cat 4 at the practice level lets you sort of visualise and analyse your practice data using multiple filters. So it's a way that allows you to kind of look at a number of things. So patients with diabetes that have had a flu vax or a number of different elements that you can look at the one time on the one easy to follow graph. It has some features around data cleaning and data cleansing. So that's going to be really important with PIP QI, and often one of the activities that practices want to start with around a quality improvement activity. And cleansing CAT that comes as part of the Cat 4 package is really a way to sort of allow you to improve your data quality, clean up registers and meet accreditation requirements. And the sort of the graph that you see on the screen on the top right-hand side sort of gives you that an example of the easy to follow graphs that it gives you. And this is a table that is traffic lighting a practice against the accreditation standards and how well a practice is or isn't meeting those. So it's easy to see that at a glance. Top bar also provides point of care clinical decision support, so that's for use in real time, and it connects directly with the practice software, so any changes that you're making through that will actually go into the clinical software. So it has a number of apps. So what's coming in CAP 4 to assist with PIP QI? So there will be an auto reply email that will be established that once the data submission is successful, we'll be sending an email back to practices so that you know that you've met your requirements for that quarter to take away some of that unknown. Whoops. There will be a patient-centred PIP QI top bar app, so that will actually relate to the patient that is seeing the GP in the room. And it notifies where there's missing information that's relevant to the improvement measures, and so you can actually do data cleansing as you go with those practices, if that's with those patients, if that's the approach you want to take. There'll also be a PIP QI tab in CAT 4, so you'll be able to click on that tab and see all the improvement measures that we put up there earlier and see how you're tracking against those at any point in time and how you're improving or not improving during that time. And we're going to be able to provide reports back to practices on how sort of you're tracking against those improvement measures. And it's going to be really useful for the relationship managers when they go out to work with practices around CAT 4, because we're able to sort of have a look at the data and help you understand that and identify those priorities for improvement, which may relate to those improvement measures, but might be something else that you want to do in your practice because you have a high proportion of mental health patients or something like that. So what do you need to do? Sort of following from here. So has anyone registered already for PIP QI? Yep. I heard this morning from the department that 50% of accredited practices have already applied, and it was only available from the 1st. So there's a lot of interest in this incentive payment. So as we said, for those that haven't, registered by PIP by HPOS. So you'll need a Proto account to do that. And if you don't have one, as Michaela said, we've got some information sheets to assist you to do that. I guess there's a question in the practice about whether you're going to apply for PIP QI. For some, it might be an easy sort of, yes, absolutely, we're going to do it, but others just might want to have a discussion about, you know, whether there's interest in applying for this in the first quarter. I think the important thing to remember is it's not a sort of one-shot deal. If you decide that you don't want to do it this quarter, but want to do it next quarter, you can actually apply at any time. As Michaela said, you'll need to tell us when you have registered for PIP QI so that we get your PIP ID. So that's what we need to send to the department at the end of the quarter. We need to send them the practice name, practice ID, and whether or not you did or didn't submit data. But that's all that we send. We do not send any of the data on to the department. Checking with us, as I said, Carly will be proactively checking with practices that haven't submitted. So we've had our first data submission for anyone who's currently doing that by pen, and we'll be able to check whether or not you've met those requirements, but we'll be doing that throughout the quarter. And meeting with your practice's relationship manager who will assist you to develop a general practice plan for ongoing QI. So what we're doing with our new way of working is getting our staff to go out to practices and start to work with practices. Thank you, Sonia, who's holding up an example of a general practice plan, to sit down with practices and work out what are your priorities over the next 12 months. It might be related to PIP QI because you want to apply for that, but in other practices it might not be that. It might be something that you're wanting to do around hiring an extra nurse or that kind of thing. And what it's really doing is getting us to have a really good understanding of what's your priorities as a practice and how we can assist you with the PHN. And sort of provide some clarity for practices that are a little bit like, I'm not quite sure what my PHN can help me with. That'll be a really good way for us to kind of have a discussion and so that everyone's really clear on what we can assist with. We've also got, as we mentioned, the quality improvement guide and tools, which gives you a lot of those tools and templates that you can use as evidence for when you're having discussions about the quality improvement work. Most practices we find are already doing quality improvement work. You've already found something in your practice that needs fixing, you've seen it in your clinical data, you've had patient feedback or provider feedback, and you've made that change, but often people have just missed the step around the documentation, and that's really what this is about. If you can document that you've had the discussion, identified the problem, had a way to measure whether you can improve or not, and have that documented and filed in case you need that evidence, and that's really what this is about. The other thing we do have is a PIP QI checklist. So if you're waiting on a visit from your relationship manager or want to have a bit of a think about it, we do have a kind of checklist that steps you through the things that you could be doing in the meantime until we're able to come out and talk to you. But please feel free to give us a call about anything that's related to that. So now